Hello everyone. Good evening. Am I visible to all of you? Am I visible? Audible? Hello everyone. Good evening. Am I visible visible, audible. Give it a thumbs up if you able to see me and hear me. Yes, yes. Okay. सर इतना पढ़ने के बाद भी नंबर एवरेज ही आया है. कोई बात नहीं. No worries. No worries. We still have lots of time. Prakash. Okay. 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 Let everyone join first. Then we will start. Paper is tough. I don't think so. Paper is tough. I'm not right. Tough to remember everything. No worries. We will make this easy over here. Okay. From other time in future, you will correct those questions. Okay. Good evening. Good evening. Good evening, Santosh. Good evening, Pratibha. Good evening, Samir. So everything is visible, now? Correct? So just everyone told me, tell me कि कितना कितना सबका score आया है. How much do you score? How much did you score? How much did you score? Okay, Samir. Okay. How much did you score, guys? 170, Pratibha. Very nice. 170. Okay. 170, Khurana. Nice. 111, Pratiksha. Okay. 128, Kavis. Nice. Samir Pandey, 165. Very nice. Payal, Payal, 175. Fixation, 156. Samir Pandey, 165. Sudeep Jana, 175. Pooja Kongane, 131. Amit Chauhan, 166. Okay. Official Akash, 121. Rohit Prasad, 171. Nice. Sanjana, 126. Okay, all right. Piyush, 158. Sameer Pandey, 165. Zero to hero. Okay, 197. Nice. Very nice. Panny, 113, sir. Zero to hero, 197. Yes, yes. I have seen your comment. Okay. Chalo, chalo, chalo. 42 is now live right now with me. Okay, shall we start? Shall we start? Jeet Parmar, 100. Okay, keep going, keep going, keep going. Vishwajit Raj, 155. Okay. Sadala, 133. All right. Very nice. Shall we start now? Nandika, Nandanik, 122. Okay. Nice, nice. Chalo, chalo, chalo. Let's start now. We will have a good session over here. Let's go. So the first question was, which of the following receptor defines, which of the following best defines a receptor in pharmacology? Okay. So options are all types of ion channels modulated by a drug, enzymes of redox reactions activated by a drug, active molecular macromolecular components, active macromolecular components of a cell of an or an organism that binds a drug to in order to elicit its specific effect, carriers activated by a drug. So which option is right? Which option is right? Yes, C option is very much right. C option is very much right. See, I have told you one thing. I've told you one thing that ion channels, redox reactions, and carriers. These all are what? Non-receptor mediated, non-receptor mediated kind of responses. These are non-receptor mediated kind of responses. That's why these are non-receptor. But if we talk about the macromolecules, yes, receptors are proteins. That's why they are macromolecules. Correct? They are macromolecules, components of a cell or an organism that drug binds in order to elicit its specific effect. Macromolecules are protein. That's why the C option will be a right option. Right? Sure. Yes, C option is right. Chalo, chalo, chalo. Next, second one. Match of the following types of adverse drug reaction, ADR, with their characteristics. Type A belongs to unpredictable, non-dose dependent. Acha, you have to match in this, okay? You have to match in this. What is going to be happen? Type A, type B, type C, type D. All right. Unpredictable, non-dose dependent, predictable, dose dependent. Chronic effects, often dose related, delayed effects, or after prolonged use. Okay, so see, we are going to have type A. Type A means that is augmented ones. Augmented ones are predictable. Augmented are predictable and dose dependent. Okay, so P, 1. Then B are non-dose dependent and unpredictable. Q, 2. Q, 2. All right. Type C is chronic and type D is delayed. Yes. So C, third, and D is fourth. Which option would be right? This one. This option would be right. Okay. Yes, yes, yes. Augmented and bizarre. Correct. 0 to hero. Yes. Very right. Chalo, chalo. So option right is A. Chalo. Yes. A for augmented. B for bizarre. That is a type B or unpredictable. So you can learn through. You can learn through this trick, that is A, B, C, D. A for augmented type A, which is very much predictable reactions. Okay. Then bizarre type B, that is unpredictable. C for continuous reaction, that is chronic reactions. And delayed type D is for delayed. All right. So let's move. Third option. Third question. Vaginal carcinoma in teenage female is also known as effect of which teratogenic drug? Which teratogenic drug? Vaginal carcinoma in teenage females is a known effect of which teratogenic drug? Tell me, tell me. Hmm? B. Yes, 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 yes. Stilbestrol. Stilbestrol is a right option. Stilbestrol. So can you tell me the classification of stilbestrol? Under which category does it come? Under which category does it come? Stilbestrol? Which category? Hmm? No? Stilbestrol would be your right answer. Chalo. So this table is very much important for you guys for the toxicity or the teratogenic effects of these drugs. This table is very much important because the direct question may arise from this question, from this table. Okay. ACE inhibitors for hypoplasia of organs, growth retardation, and fetal loss. Alcohol, low IQ baby. Then androgens, virilization. These terms, from these terms only, you will crack the question. You will crack the question. Okay. Next, antithyroid, fetal goiter. Carbamazepine, neural tube defects. Just note it down, these things which I am circling right now. The question will ask from here only. Okay. Endomethacin, ductus arteriosus. Aspirin. Aspirin will show also the Ray's syndromes. Ray's syndrome. Phenytoin, hypoplastic phalanges. Hypoplastic phalanges. Okay. And one of the adverse effect of phenytoin that has been asked in just happened AIMS pharmacist exam, AIMS CRE, phenytoin, is gingival hyperplasia. Gingival hyperplasia. This adverse effect of phenytoin has been recently asked in AIMS CRE exam. Okay, phenytoin. Chalo. Okay. Tetracycline, discolored, yellowish tooth, or retard bone growth. That is very much known to you. Thalidomide, phocomelia, very much known to you. Valproate, this term. Spina bifida, this term. Spina bifida. Warfarin, socket-like nose. Socket-like nose. Can you guys tell me what is the antidote of warfarin? What is the antidote of warfarin? Can you guys tell me? What is the antidote of warfarin? Yes, 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 0 to hero. Yes. Chalo, till then, we'll start on to the next question. The following is true about competitive antagonists. I'm seeing your comments in the comment section. Okay. Give your answers over there. Over there. Vitamin K. Yes, Pratibha. Nice. Very nice. Heparin. No. No, no. Sahil. No. No. Even this question has been asked in AIMS-CRE. That what is the antidote of warfarin? Question options were there that it is protamine sulfate, vitamin K, and two other things also. Okay, so keep it that in mind. Heparin is for protamine sulfate is for heparin, and vitamin K is for warfarin. Okay, so don't be confused in that. Okay, chalo. The following is true about competitive antagonism. Okay, nice. Competitive antagonism. It is a part of enzyme inhibition. Okay, the same maximum response can be attained by increasing dose of agonist. Okay, all right. It is also surmountable or equilibrium type of antagonism. Okay, antagonism does not resemble chemically with the agonist. So, which option will be right? Which option will be right? Antagonists bind to the same site of the agonist. See, there is a substrate. There is a substrate, and there is a enzyme. There is an enzyme. There is a substrate, and there is a inhibitory drug as well. Inhibitory drug. Okay, inhibitory drug. Whereas substrate and inhibitory drug both resembles with their structure. Both resembles with their structure because both the substrate as well as the inhibitory drug would be in the similar structure to bind onto the this active site. To bind onto the this active site, and they will compete with each other. They will compete with each other. Okay, now compete with each other at the same site, and that site is called as the active site. So antagonist binds to the same site of the agonist. Yes, correct. The same maximum response can be attained by increasing dose of agonist. Yes, correct. It is also correct because once you increase the concentration or dose of the substrate, that will replace the position of inhibitory drug from the active site. That is why competitive antagonist is also called as surmountable type of antagonist. These both options are correlated with each other. These both options are correlated with each other. Okay. Now, antagonist does not resemble chemically with agonist. No, this one is wrong. This one is wrong. Antagonist does not resemble chemically with agonist. Just I have told you that both substrate and the inhibitory drug both will be in the similar structure. All right. All right. All right. Chalo. Let's move ahead. Let's move ahead. Yes. So PQR is right. S is wrong. Okay. So antagonist binds with the same receptor. Antagonist resembles chemically with the agonist. Yes, it resembles chemically with the agonist. Okay. Parallel right shift of agonist in the DRC. I will let you know in some other questions. We do have other question of it also. Okay. So the maximum same response can be attained increasing due to increasing dose of agonist. All right. Intensity of response depends on the concentration of both agonist and antagonist. Correct. Example. These examples are very much important for you guys. The direct question may arise from the examples only. Acetylcholine, atropine, morphine, naloxone. Okay. Sure. I have done 41 correct and 3 wrong. And 6 unattempted. Jatin Pal. Very good, Jatin. Keep going. Keep going. Chalo. Which of the following is a correct example of ligand-gated ion channel? Which of the following is a correct example of ligand-gated ion channel? GABA receptors in the brain? Yes. NMDA receptors for glutamate? Yes. NM receptor for neuromuscular junction? Yes. And all of the above. Answer would be your all of the above. Here, that is inhibitory, that is ligand-gated ion channel, that is LGIC. 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 Ligand-gated ion channel. NMDA receptor for glutamate, yes, is for potassium. NM receptors for neuromuscular junction, yes, that is also a ligand-gated ion channel. Okay. So answer would be all of the above. Correct? Chalo. Yes. Brain receptors, GABA receptor, yes. Glutamate and MDA receptor, that is stimulatory. Junction of two nerves, NN receptor. Neuromuscular junction have NM receptors. So, and note it down in your notes that one of the receptor of serotonin, one of these receptor of serotonin is fastest. Which one it is? 5-HT3. This one is important for you guys. That 5-HT receptor is the fastest acting serotonin receptor, and it is only receptor which is inotropic. Inotropic. The rest of the serotonin receptors are GPCR mediated. The rest of the receptors of serotonin are GPCR mediated. Okay. Chalo. Match of the following clinical trial with their primary purpose. What is the primary purpose of those clinical trial? So, you guys telling me your answers? What would be the right answer in this one? Sixth. What would be the right answer in sixth? Hmm? A. Okay. Let's see. A. Okay. Pratibha, Jatin, Piyush. Okay. Smriti Patel. Okay. Chalo. Let's see. Phase 1. Phase 1 is for the safety. Okay. Phase 2 is for effectiveness. Phase 3. Okay. Large patient groups. Phase 4. Post-marketing surveillance. See, one of the easiest ways to crack this question is Phase 4 is post-marketing surveillance. Fourth is Fourth is S is fourth, right? One of the easiest one. Then, so option would be this one, right? This one will be your right option over here. What is happening? Yeah, it is not running. Yes. So this option would be your, yeah, right. Okay. P for second, assess drug safety and dosage. First, phase one is, we'll just look onto the drug safety only. Phase two will see the efficacy, efficacy in large patient groups, correct? And R for long-term safety and effectiveness. All right. Yes. So this would be your right answer. Sure. 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 And see, in this table, these things are also important. No, which of the following have a which of the following have a different name? Means here you can see the other names of phase 2, phase 1, phase 3 and phase 4 trials. Okay, so examiner can ask you the other name of phase 1 trial, other name of phase 2 trial. Okay, then phase 1 is human pharmacological safety. Okay, it is also known as human pharmacology and safety. Phase 2 is also known as therapeutic exploratory. Phase 3 is also known as the therapeutic confirmatory. And phase 4 is also known as post-marketing surveillance. That is known to you. But how will you remember it? See, the first priority, first, the first priority, the first priority is for clinical trial is to have a safety, human safety, isn't it? First to have a human safety, human and safety. From this way, you can learn that phase one have, in phase one, we do have a priority of human safety. Phase one, safety. Okay. Now, phase three, three. In ABCD, what do you get? Three. What do you get at three? C1, na? C. Three for C. 3 for C, therapeutic confirmatory. C, 3 for C, you can learn from that. Phase 3 is also known as the therapeutic confirmatory phase. Then therapeutic exploratory phase 2. And this one is very much known to you. That is post-marketing surveillance and pharmacovigilance. Okay, all right. Chalo. Which of the following is correct management approach for type B bizarre adverse drug reaction? What is the following correct management? Correct management is being asked. Okay, for a type B bizarre adverse drug reaction. Reduce the dose, withhold the drug, and avoid future use. Increase the dose, reintroduce, and withdraw slowly. So, what would be the right management? What would be the correct management? Yes, Saurabh. Yes, good Pratibha. Nice, Piyush, Smriti. Very nice. Very nice. Withhold the drug and avoid future use. This would be your correct answer. Okay, sure. Match of the following GPCR with their major signaling pathways. Match of the following GPCR with their major signaling pathways. So we do have adrenergic, histamine, angiotensin 1 and opioid K. Okay. So adrenergic have adrenergic have all the beta 1, beta 2 and beta 3 have GS mediated, isn't it? GS mediated. So GS mediated, which means it will increase the CAMP. It will increase the CMP. So A for 3. A for 3. Histamine. Histamine. First one is because it is a autoreceptor. H1 is a autoreceptor. H1 is a autoreceptor. That's why it will decrease the CAMP. Isn't it? It will decrease the CAMP. Angiotensin 1. Wait. Where I'm going? Where I'm going? Where I'm going? Adrenergic adenyl cyclase A3. Okay, where I'm going? No. Wait. There is a confusion I have. That histamine is for activation of phospholipase C. Okay, H1 is GQ. H1 is GQ. And adrenergic are this. So from here only you can crack the question. That A is for 3. A is for 3 and B for 1. A for 3 and B for 1. Angiotensin 81 is inhibitory, is calcium channel is inhibiting the adenyl cyclase. Okay, that would be the right answer. Chalo. A. Okay, okay, okay. Let's move. Which of the following receptor demonstrate the slowest onset of action upon activation? Okay. So now, what is the fastest? Fastest is ligand-gated ion channel. Ligand-gated ion channel is the fastest one. Nice. Then, and what kind of receptors are very much present in our body? What kind of receptor? What kind of receptor? That is GPCR. Majority of the receptors, right? And nuclear receptors are the slowest one. Nuclear receptor are the slowest one. Yes, right. Nuclear one are the slowest. So, therapeutic index, therapeutic window, quantal DRC, and gradual DRC. Okay. So therapeutic index is like lethal dose and effective dose. Yes. Tile. Getting the trick? Tile. Therapeutic index, lethal dose upon effective dose. Yes, the therapeutic index is the ratio of toxic dose to effective dose. Yes, right. This one is right. Therapeutic range between minimal and toxic doses. Yes, this is also right. So P is for 1, Q is for 2, Q is for 2. Quantal drug sure which is either present or absent. Yes. So quantal means quantify. Quantal means quantify. That is, a drug is present or not present. That is, drug effect is present or not present. Okay. Graded with increases respect to the increased dose of drug. That is specifically onto the basis of log dose. Log dose. Okay. So this one is right. Chalo. Therapeutic index is index of drug safety. From here also you can expect the question, that is drug safety. Okay, therapeutics index is an index of drug safety, is a ratio of toxic dose and therapeutic dose, that is lethal dose upon effective dose. Okay, so therapeutic window is minimum effective concentration divided by maximum safe concentration. All right, so which of the following is a receptor mediated mechanism of drug action? Which of the following is a receptor mediated mechanism of drug action? Receptor mediated. Transporters? No. Through enzymes? No. Ligand gated ion channels? Yes. Physical action? No. See, transporters, enzymes, and physical action, they all are the non receptor mediated drug action, right? But if there is written, that is voltage gated ion channel, then voltage gated ion channel, this is receptor mediated or non receptor mediated? What it is what it is, receptor mediated or non receptor mediated? Hmm? Physical charcoal, very good, Pratibha. Tell me. Voltage gated ion channel is a non receptor mediated drug action or receptor mediated drug action? Hmm? Kavi's king. Yes. Non-receptor mediated. See, there are two types of ion channels. First one is ligand-gated ion channel, and second one is voltage-gated ion channel. So, if the drug bind as a ligand onto the receptor, that is ion channel, that it is a receptor mediated. But if we talk about no, Pratiksha, no, Pratibha, no Kishan. See, if the drug binds onto the ligand-gated ion channel, then it is a receptor mediated. But if the drug is acting onto the voltage imbalance, just like in the case of cardiac activity, that is action potential, right? In that case, there is a voltage gated ion channel in the response of the imbalance of the ions. These voltage gated ion channels may play a role. So, ligand gated ion channels. Okay, all right. Next, non-receptor by physical action, chemical reaction through enzymes, ion channels. Yes, that's what I'm talking about. This through ion channel, that is voltage gated ion channel. Voltage gated ion channel. Okay, through antibody production transporters. Ligand gated ion channel, G protein, enzymatic, nuclear. Okay, चलो जतिन मैं जीडीसी इंग्लिश में क्लास लेता हूँ. Okay, GDC English is a separate of kind of batch for the South students. That's why I used to take on the GDC English. I will come on to the GDC main channel once. Okay, wait for me. So, match of the following receptors with their couplers. Okay, that one is very much correct. Chalo. So, 12th question. Which one is right? Yes, yes, yes. Serotonin, 5-HT2, dopamine, prostanoid, beta adrenergic. Beta adrenergic is GS. That is S ka third. S third. S third. Yes. This one. D. P ka second. P serotonin. Sorry. Beta adrenergic. G S ka 2. No, 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 no. Wait. Beta adrenergic is for GS. Okay. So S for 2. Yes. This would be your right. C. C, right? Okay. Okay. Chalo. Let's move fast. Chalo. Okay. Identify the correct statement regarding drug-induced teratogenicity. So these are some adverse drug effect of the compound drugs. You need to match which one is right combination. Thalidomide causes phocomelia. Yes, correct. Valproate is associated with neural tube. Yes, it is also correct. Tetracycline cause yellow teeth. Yes, it is also correct. Alcohol has no teratogenic effect. No, it do have teratogenic effect. It is low IQ baby. Low IQ baby. Isn't it? So PQR would be your right. Okay. So PQR would be right. This table is very much important for you guys. Just take a screenshot of it and try to revise it. Okay. So. Phase 1 just covered. Phase 1, phase 2, phase 3, phase 4. Phase 1 is for phase 4 post marketing. S ka first. Okay. So this is wrong. This is wrong. Now therapeutic confirmation C third. R ka third. R for third. So this would be no. R ka third. So this would be your right option. Okay. So this would be your right option. Correct? Yes. This would be your right option. So same things again. Which type of receptor exhibits the most rapid onset of action upon stimulation? We just talked. But which one is the fastest one? Inotropic, ligand-gated ion channel receptors. These are the slowest one, most abundant, isn't it? Chalo. Inotropic, ligand-gated. Chalo. Identify the drugs correctly matched with their fetal effects. Okay. Lithium, cardiac and other abnormalities. Carbamazepine, neural tube effects. Okay. progestins virilization, yes. Isotretinoin, hydrocephalus, and craniofacial facial defects. Okay, so answer would be P is right, Q is also right, R is also right, and S is also right. Okay, so all of the above. Yes, all of the above. Chalo. Which of the following statements about adenyl cyclase is incorrect? Not correct. It is incorrect. It is a membrane-bound enzyme. Yes. It is mediated by phosphodiesterase. It is mediated by phosphodiesterase. No. It catalyzes the formation of cyclic AMP. Correct. It is activated by interaction with G protein. Yes, correct. So answer would be this one. This option is wrong. Is incorrect. Okay. Chalo. Yes. Okay. Chalo. What is the term refers to the requirement of higher dose of a drug to produce a given response? Okay. Okay. What is the term refers to the requirement of higher dose of a drug produce a given response? This term is known as the tolerance. Tolerance. So what does tolerance means? That there is a higher dose of drug needs to be given after some time. After some, it does not show initially. After some time that the patient founds a tolerance of a drug, and it needs a higher doses to produce a same effect as it was seen before also. So the tolerance is also known as the refractoriness. Also known as refractoriness. Okay. So drug resistance is for the antibiotics. Tachyphylaxis is the rapid tolerance. Rapid tolerance. Idiosyncrasy is due to the genetic differences. Okay. Chalo. Refractoriness. Right. Yes. Which of matched of the following enzymes with their competitive inhibitors. Okay. So cholinesterase is for physostigmine, right? Xanthine oxidase, allopurinol, monoamine oxidase, moclobemide, dopa decarboxylase, menserolide. Isn't it? So the correct option is first is going allopurinol. No, first is going to physostigmine. P ka third. C. P ka third would be your right option. C. Okay? Sure. Yes. Nice. Okay. In which of the clinical trials should be geriatric population typically be to be included to assess drug safety and efficacy in real world conditions? In real world conditions. If you found any of the term that is real world conditions, automatically would be the answer is phase 4, real world. Okay? Yes. So phase 4. So identify the correct statements regarding the drug antagonist. Identify the correct statement regarding the drug antagonist. They have correct statement regarding the drug antagonist. Okay. They have affinity but no intrinsic activity, right? They activate receptor to produce maximal response. No. They prevent agonist binding the receptors, right? They have both affinity and intrinsic activity. No. What is the intrinsic activity of antagonist? Can anyone tell me? Can anyone tell me what is the intrinsic activity of antagonist? PNR. PNR would be your right. Sure. Which of the following statement about receptors is true? Which of the following statement about receptors is true? All right. See, Amit Chauhan, if there is a world called as geriatric patients in the real world, then it is phase 4. If it has been asked that it is in clinical trial, then the answer would be the phase 3. All right. Which of the following statements about receptor is true? Orphan receptor have an endogenous ligand? No. Silent receptor binds specific but elicit a pharmacological response? No. Orphan drugs are receptor for which no endogenous mediator or ligand is present. Yes. Endogenous mediator or ligand is present. Silent receptors are receptor that always produce a pharmacological response when a drug binds. No. They always produce a pharmacological response. No. They will not show a pharmacological response because silent receptors are the receptor which show no response even after binding to a drug. Okay. Orphan receptors for which no endogenous mediator or ligand is present, but orphan receptors can be. There are some orphan drugs also, no? So there are some orphan drugs which are for rare diseases, right? Which are for rare diseases. Sure. So this option will be right. Silent receptor is a receptor which binds but no pharmacological response is elicited. Okay. Sure. Which of the following non-competitive inhibitors with their enzyme? Okay, you have to match it again. You have to match it again. Disulfiram, aldehyde, dehydrogenase. So P ka 4. P4. This one is wrong. This one is wrong. Theophylline, phosphodiesterase. Q ka second. Q ka second. Yes. So this would be your right option. Digoxin, sodium potassium ATPase. Aspirin, cyclooxygenase. Yes. So B1. Okay. Chalo. This table is very much important for you. Direct question may ask from this table also. Okay. So, which of the following refers to a negative psychodynamic effect caused by the loss of faith in a medication or the healthcare provider or the healthcare provider? What it is? What is it? Which of the following refers to a negative psychodynamic effect caused by the loss of faith in a medication or the healthcare provider? Is it placebo or nocebo? What is it? It is placebo or nocebo? Yes, correct. D, correct. Very good. The nocebo effect is particularly belongs for the healthcare provider. All right. Sure. Nocebo effect. Nocebo, it is the converse of placebo. Negative psychodynamic effect. This word should be keep in your mind. Negative psychodynamic effect evoked by loss of faith in medication or physician. Okay. Sure. Identify the correct statement about adverse drug reactions, ADR. Adverse drug reactions, ADR. They can be dose dependent or idiosyncratic. Okay, all right. They only occur at therapeutic dose. No. They may involve allergic or immune mediated mechanisms. Yes, right. They're always predictable. They're always predictable. No. There are some adverse effects which are unpredictable as well. Okay. So PNR would be your right. PNR. Isn't it? Sure. Yes. A, B, C, D. A for augmented, predictable. B, bizarre. Type B, unpredictable. C for chronic and D for delay. Okay. C for chronic and D for delay. So, what is the correct formula to calculate the therapeutic index? What is the correct formula to calculate the therapeutic index? TILE, lethal dose and effective dose. Lethal dose and effective dose, and the median part of it. Median lethal dose and median effective dose. This one would be your right one. Correct? Chalo. Match of the following term with their correct definitions. Okay. So didn't you guys tell me about the intrinsic activity of antagonist? No. Acha. Kavi's king 0, Swara 0, nice. Swara 0, Shashank class is 0, Piyush Raj 0. Okay. Nice, very nice. Chalo. Match of the following terms with their correct definitions. A for agonist. Okay. Agonists have what? Have both affinity and maximal intrinsic activity. So one for B. One for B. Antagonist have affinity but no intrinsic activity. Right? Correct. Partial agonist have infinity and some maximal activity. 3 ka C. So inverse agonist have affinity but opposite intrinsic activity. So can you guys tell me the intrinsic activity of partial agonist? Partial agonist? Intrinsic activity of partial agonist? Write down in your comment section. Which of the following drug combines and is an example of supraadditive potentiation interaction, where the combined effect is where the combined effect is greater than the sum of individual effect. 1 plus 1 is equal to 3. Okay. 1 plus 1 is equal to 3. It is known as the supraadditive. It is known as supraadditive. Okay. So which one is it? It is asked from direct examples. Direct example. So the levodopa and carbidopa inhibition of levodopa metabolism would be your right answer. Okay. Pratibha 0 to 1. Kavi's king 0 to 1. Yes. Correct. Okay. So the examples are very much important for you as well. Okay. So, so. Identify the correct statement about the phases of clinical trials. Okay. Phase 1 trials assess safety and dosage. Right. Phase 2 trial focus on the efficacy and side effect. Right. Phase 3 trial compare the new treatment to standard treatment. Yes. Phase 4 are conducted before the drug is approved. No. It is conducted after the drug approval. After the drug approval. Okay. After the drug approval, it is being conducted. So PQR would be your right answer. PQR. Chalo. Which of the following G protein subunit is correctly matched with its action on effector? Okay. So GS, adenyl cyclic inhibition, potassium channel opening. No. GI, adenyl cyclase activation, calcium channel opening. No. Calcium channel inhibition. Yes. GO is calcium channel inhibition. That is, it is a channel regulation mediator. It is regulated by channel regulation. GQ, adenyl cyclase activation. No, it is for the IP3-DAG pathway. IP3-DAG pathway. Inhibition. No, it is a stimulatory effect. GS is for the stimulatory. GI for inhibitory. GI is for inhibitory. Okay. Chalo. What does the response curve represent in the pharmacology? The relation between drug metabolism and excretion? No. The graph between drug dose and its routes of administration? No. The graph between drug dose and the pharmacological effect produced? Yes. So the graph which is produced between the dose and pharmacological effect is known to be DRC. Okay. Drug prices and efficacy? No. So, okay. So. Next question. Which of the following drug with synergistic action? Which of the following drug with synergistic action? With their synergistic action match. You have to match it. Ephedrine and theophylline. It is for the bronchodilators. Ephedrine and theophylline acts on the bronchodilator. Can you guys tell me on which phosphodiesterase does theophylline acts? Which phosphodiesterase does theophylline acts? Levodopa and carbidopa, analgesic antibiotic, inhibition of neuronal uptake, inhibition of peripheral metabolism. P for one. Okay. Adrenaline and cocaine. Adrenaline cocaine inhibition of neuronal uptake. Third. R का third. Okay. And levodopa is for here and aspirin paracetamol is here. Okay. So PA wala option is right. Okay. So alveoli. Which phosphodiesterase? Kavis. Which phosphodiesterase? T cell mediated destruction of the intestine in colic disease, an example of which type of hypertensive sensitivity reaction? T cell mediated. T cell mediated destruction. T cell mediated destruction is for the type 4. Type 4. Okay. Among three, these are the humoral. Among three, these are the humoral ones, and 4 is the cell mediated. Cell mediated. Okay. So, yes. So, type 1 is for IgE antibodies. Correct. Type 2 is for cytotoxic. Here, cytotoxic, through cytotoxic, you can learn 2. That is 2. And 2 for 2 antibodies. That is IgG and IgM antibody. Type 3, IgG. Specifically IgG, not IgM. Specifically, it is for IgG. And type 4 is for delayed. That is T cell. That is cell mediated. Okay. Here also, you can learn this, that blood transfusion reaction comes under type 2. Okay, all right. Steven-Johnson syndromes comes under type 3. And there is a Arthur's reaction. Arthur's reaction, which comes under type 3. Okay, chalo. Identify the correct statement regarding G protein coupled receptor. They have 7 membrane alpha helix. Yes. Shortest family of cell membrane. No. They activate intracellular signaling via G proteins. Yes. GPCR controls cell functioning of adenyl cyclase, phospholipase C, and ion channels. Yes. So answer would be your PRS. PRS. Okay. PRS. Phosphodiesterase 5. Correct, Pratibha. Phosphodiesterase 5. So, RBC restriction during blood transfusion incompatibility. I have just told you. RBC destruction during blood transfusion incompatibility is a kind of type 2 hypersensitivity. Okay. So, tachyphylaxis is best described as gradual decrease in drug response over prolonged use, rapid decrease in drug response, after repeated administration, increased sensitivity to a drug after repeated use, no change in drug response despite increased dosage. Okay. So, right option tachyphylaxis is just like rapid tolerance. Rapid tolerance. So, there is a rapid decrease. There is a rapid decrease in drug response after repeated administration. So, B would be your right option. Correct? Chalo. Yes. G protein coupled receptor whose effector pathway is phospholipase C IP3-DAG. IP3-DAG. What would be the right option? You tell me now. You tell me now. Which one is right? Which one is right? G protein coupled receptor IP3-DAG. Hmm? IP3-DAG? GQ? GS? Okay, so option would be your G alpha 1, that is GQ mediated. Okay, so is an agent which binds to the receptor, binding as an agonist for the receptor and reverse constitute activity of the receptor. Okay, reverse. So what would be the answer? Is an agent. No, Pratiksha, it is not all of the above. Okay, Nishant Singh has been live. Okay, so it is an agent which binds to the same receptor, binding as an agonist for that receptor and reverse constitute activity of receptor. So it will be the inverse agonist. It has the affinity for the same receptor, but it is constituting the reverse response. So what would be the answer? The answer will be the inverse agonist. Inverse agonist. Sorry. Okay, okay, okay. So now, which of the following effects can be seen in competitive antagonism in a drug response curve? See, there is a drug response curve. Here you have given the agonist. Here you have given the agonist, and you have given the agonist, agonist plus antagonist. Okay. Now, this is a competitive inhibition for the same site, in which in what was happening in the competitive antagonism, that is, it is happening on the same side, competitive antagonism. Now, this will be shift towards the right. This will shift towards the right, which is in the parallel right shift. It is not non-parallel. It is not non-competitive. It is not non-competitive. It is a competitive. If the answer would have asked that in the non-competitive, then it would be non-parallel shift. Okay. It is now being as a parallel right shift. Parallel right shift. All right. So parallel right shift. Okay. So which of the following statement about the competitive inhibition of an enzyme catalyzed reaction is correct? Okay, so what is happening in the competitive inhibition? Competitive inhibition, the substrate and the inhibitor is binding onto the same active site of the enzyme. Yes. So what was happening at that time? So the correct option is being asked. Okay. A competitive inhibitor and substrate can bind simultaneously to the enzyme. No, it cannot bind to the simultaneously. One, that is inhibitor, or it can be the substrate can bind to the enzyme. It will not bind to the simultaneously. The Vmax and Km are remain unchanged. No, they are not remain unchanged. The Vmax for a reaction remains unchanged in the presence of competitive inhibitor. Yes, Vmax for a reaction remains unchanged in the presence of competitive inhibition. Jaffer didn't understand, sir. Which part? Which part? You didn't understand. See, in competitive inhibition, what is happening? Km would be increased and Vmax remains the same. How? Let me explain you now over here. Let me explain you over here. See, there is a substrate and there is a enzyme and there is a inhibitor. Correct? There is a inhibitor. What is happening over here? The substrate and the inhibitor has same affinity for the enzyme and they are competing for the active site, competing for the active site. Okay. So the inhibitor will bind onto the enzyme. Inhibitor will be bind onto the enzyme and the Km would be increase. What is Km? Km is a Michaelis Menten constant, Michaelis Menten constant, which shows you about the amount of substrate that is required to produce the activity enzymatic activity. So here, if the inhibitor is going to bind onto the active site, then because this competitive inhibition is surmountable in nature, no, surmountable in nature. So if we increase the amount of substrate, then only the substrate will bind onto the active site of enzyme, isn't it? That's why Km is increase. There is one more concept about affinity. Affinity, that is, it is inversely proportional to Inversely proportional to affinity. Okay, it is inversely proportional to affinity. All right, that is affinity of the substrate is low here. That's why Km is increased. So, see. Okay, which of the following pair regarding antidote and its indication in poisoning? It's not correct. Which is not correct. Okay, carbamates, atropine, correct. Warfarin, vitamin K, correct. Opioids, naloxone, correct. Atropine, flubenzyl, no. These both are the antidotes. Atropine is an antidote of physostigmine, whereas flubenzyl is an antidote of benzodiazepines. Okay, chal. This table is very much important. This table is very much important for you guys. Okay, chal. The following receptors has seven helical membranes spanning amino acid segments and three extracellular and three intracellular loops. So what would be? It is a GPCR. It is GPCR, G protein coupled receptor. Okay. So G protein coupled receptor. Which of the following statement regarding phase 2 clinical trial is correct? Correct. Phase 2 clinical trials are pivotal trials. No, phase 3 are the pivotal trials. Okay. Phase 2 study in primarily done to determine the toxicology and pharmacokinetics of the testing drug. No, it does on to the phase 1 only. Phase 1 only. Okay. Phase 2 study is the first control clinical study done to determine efficacy and safety in patients. Yes, it is the first control clinical study. Okay. For in phase 1, there is only safety. Phase 2, there is safety as well as efficacy. That is why phase 2 is the first control clinical study to determine efficacy and safety in patients. All right. So this would be your correct option. Phase 2 begins with the submission of new drug approval. No. New drug approval is given at NDA, that is phase 3rd. Phase 3rd. Okay. So this option is right. After the phase 3rd, the NDA is filed. Okay. So which of the following are the correct pair of the phases of clinical trials? Phase 1 is human pharmacology. Yes, right. Phase 4 is therapeutic confirmation. Yes, right. Phase 4 is post-marketing surveillance. Correct. Phase 0, therapeutic exploratory trials. No, it is for the phase 2. It is for the phase 2. All right. Phase 2. Okay. Chalo. So option would be your PQR. All right. PQR. Chalo. The following statement is not true of potency of a drug. Not true. Not true of potency of a drug. 0 is microdosing. Correct, Smriti Patel. Correct. Refers to the dose of the drug needed to produce a certain degree of response. This one is right for a potency. A DRC position rightward indicates lower potency. Correct. C, A, and B. In this graph, can you guys tell me which one is more potent and which one is less potent? Which drug is more potent and which one is more potent? Drug potency is clearly a factor in choosing the dose of a drug. Correct. The more the potent of drug, the more will be the factors to choose that drug, isn't it? It reflects the capacity of a drug to produce a drastic response. No, it is not a correct option. Okay. So answer would be this D. Which one is more potent? Which one is more potent? A is more potent. Correct. Pratibha, correct. Satyanarayana, Raju, correct. A is more potent. Okay, very good. Chalo. And which one is more efficacious? Which one is more efficacious in the context of A and B? You skip the question, Piyush Raj. Okay, go on. No worries, no worries. Chalo. Okay. Next, which of the following statement regarding placebo is incorrect? Placebo is incorrect. Placebo is dummy medication. It is a right option. Placebo is an inert substance. Yes, it is a right option, which gives the garb of medicine. Correct. Do not induce physiological responses. Yes, it is also right. It works by pharmacodynamic rather than psychodynamic means. No, it works by psychodynamic. It works by psychodynamic, not by pharmacodynamics. All right, not by pharmacodynamic. It works by psychodynamic. Other than all the drugs works by the pharmacodynamics conditions. Okay. So, which of the following statements regarding placebo is incorrect? D option is right. So, in the context of hypersensitivity, arrange the following type of reactions in the correct order from type 2, 1 to 4. Okay. Chalo. So, anaphylactic would be the first one. Cytotoxic would be the second one. Immune complex would be the third one. And this one is fourth. First, second, and fourth. So, B, RPQS. Okay. सर डीएमआर के लिए देख सकते हैं क्या सर? क्या देख सकते हैं धीरज? हाँ हाँ बिल्कुल देख सकते हैं. This is all for the pharmacy exams. This is all for pharmacy exams. You can see it because ultimately यही questions आपके DMR में भी आएंगे. You know, pharmacy subject का जो syllabus है वो हर जगह same है. Okay, चलो. Okay, all right. So the appearance of characteristic toxic effect of drug in the individual at therapeutic dose is known as idiosyncrasy, intolerance, dependence, side effect. See, idiosyncrasy is a abnormal or unusual response. Lecture sir, कौन सा lecture? Unusual response due to genetic difference. Okay. Intolerance. 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 Intolerance is a normal therapeutic dose. It happens on the normal therapeutic dose and it is a toxic one. See where you guys are wrong. Where you guys are wrong. This is a toxic. It has been asked that is toxic. It is not side effect. If it is found to be the predictable one, if it is found to be the predictable one, then the option would be side effect. But here the toxic effect would be the intolerance. Okay. Toxic one would be the intolerance. So intolerance. Among the following, which one is a potent and specific chelator of iron used in the treatment of iron poisoning? Desferoxamine, disulfiram, erythropoietin, ferric gluconate. Desferoxamine is a correct option that is given through IV. That is given through IV for iron toxicity. But what is for iron toxicity, which was given as a oral, which been given as oral? Which kind of drug? Defibrone, deferiprone. Deferiprone is an antidote of iron poisoning, which is given orally, which is given as orally for the iron poisoning. Okay, that must should be written in your notes. It can be asked. Okay, for IV that is desferoxamine. For oral that is deferiprone. Deferiprone. Okay, chal desferoxamine. This antidote, this table, very much important. It has been asked in various times of exams. Okay, So paracetamol and acetylcysteine as well as methionine. As well as methionine. Methionine is for the NAPK production. It is neutralizing the NAPK production. Methionine. Okay. That is essential amino acid. All right. So match the following correct pair based on the intrinsic activity. Agonist 1, competitive antagonist 0, inverse agonist -1, partial agonist +1. Okay, so the option is A for 2, A for 2, then B for first, correct? B for first, okay, all right. C for 3, yes. So option would be your A. So this would be your correct option. Okay. So yes, so this is all about the today's weekly test discussion. I hope I have made you clear about these concepts and will look you forward for the future weekly test. Okay, all right. Till then, keep preparing and keep grinding yourself. As I always say, keep grinding yourself. Okay, after some time, you will see your fruitful results of your grinding. Until then, tata, bye bye, and good night. So, bye bye.